So Renuka Iyer was a fellow here. She was a fellow in my laboratory. She had a thirst for knowledge. She had all these great ideas. And you just knew, Renuka Iyer, she's going to be somebody.
She recognized that Roswell Park is a center of excellence. She developed a GI program, and she really excelled at translating laboratory work into the clinic.
She does extensive research in neuroendocrine tumors that is remarkably unique and remarkably interesting, using models that I was completely unaware of, and I've been in the business for 25 years.
Once you find that idea that you have to pursue, then there are no excuses. Nobel Prize winners did not know they were doing Nobel Prize winning work when they did it. They did it because they believed in it. And then they rallied and hustled and did everything they had to do. There were no excuses. And so when you find that work, you don't know what's going to come, but you must finish it.
I think she thinks about things as a scientist would, always trying to understand things better, always trying to think, can I do this a little bit differently? And Renuka has done remarkable things in furthering her work in liver cancer.
I'm Bruce Werner. I've been living with liver cancer for at least 8.5 years. One of the things that initially scared me when I found out I had cancer was that this is going to cut us short. Dr. Iyer said, we have a plan. We have a trial we're going to try.
The results from the trial have been astounding. Some of the patients have had tremendous success and have done well for over a year, 2 years, and this has been wonderful to see. And from that work, I've gotten the chance to get other grants and now lead as National PI multiple grants and be on grant review committees, chair them. And all of this tells me that Roswell now has a seat at the table when it comes to developing the future of liver cancer therapies.
She's done a fantastic job at being a physician, but it's tough. It's a tough situation to be treating these patients where there are limited opportunities for therapies, for different approaches.
One thing we can all learn from Dr. Iyer is compassion. Apart from being an excellent clinician and being a top-notch expert in her field, the compassion she shows for her patients is just amazing.
I like to think that I'm someone that tries to give her best and tries to be with whoever I'm at that time. So you have to value time, and the time that they give you in the clinic visit or the time that they're fighting to have, if you value it and you know how to treasure it and fight for it, makes you better in everything.
She does not come in with a clipboard and, I got so much time, how you doing? Okay, fine, good to see you, I gotta go. She's there for me. I'm not the only one in the hospital that probably feels that way. She's probably got a whole fan club.
Patients love and trust her. She's going to find the very best treatment, and you've got the best chance when you've got Renuka Iyer as your doctor.
She enjoys taking care of patients, she enjoys clinical work, and at the same time she enjoys academic work and research. So that's what makes her a complete package in my view.
I think part of the opportunity to lead or have a leadership position, it's a responsibility. It's a responsibility to do your job well, and it's also a responsibility to not just shape someone's career, but to shape their life.
I can't think of anyone that I have met at this institution since I've been here that is more doggedly committed to mentoring our junior faculty. She is so well liked and so well recognized, and so many people come to her of our junior faculty for advice. And the advice she gives is usually quite outstanding.
I want people to drive and fly and come to Roswell to train and say, this is the place to go if I want to study GI cancers or whichever particular disease.
She's a great mentor, and over the last 2 decades, she has changed the lives of several of our mentees. And I have no hesitation in saying that I owe my career to Dr. Iyer.
In medicine, we cannot succeed on our own. We need, people around us. We need to have a good team. Dr. Iyer has been both a clinical mentor and a research mentor.
Each time one of my junior faculty, colleagues, fellows gets an award, gets recognized, it reminds me like, aha, we've sent one more person, one more ambassador of Roswell. They are taking the name of Roswell Park on their CV forward wherever they go.
She has spent really most of her oncology career, or all of it, at one institution, at Roswell Park. And that leaves a great legacy because I think she has contributed significantly to the strength of that institution.
You might be my #1 favorite doctor in the entire world. And what you've done for me beyond treatment is really giving me hope for the future and confidence that it's gonna be okay.
There's probably no one that I know deserves this more than her. I aspire to be like her someday.
Renuka is exactly what this award should be given for. She's the whole picture. She's a scientist. She's an incredible physician. She connects with people. She bleeds, thinks Roswell. I mean, if that's not a legacy, I don't know what is.
Renuka Iyer's legacy is that she is not the prototype of a physician scientist, but the ideal of a physician scientist, and one which future generations should work hard to try to emulate.
I think the road we are on is the road we should be on. There might be many more roads, but this is my journey and I'm happy I'm on it.